Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Have you ever heard of the word cholethiasis? Many people have not, but I'm sure you are familiar with the term gallstones, and that is what cholethiasis is. Now, this is very, very common, and I want to talk about it in detail today because we know that 80% of people who have gallstones are completely asymptomatic, and we need to be able to address this problem, being that we know that statistically speaking, this affects close to 15% of the U.S. population. I mean, that's millions and millions of people who are dealing with gallstones and trying to understand what creates gallstones, why do they develop in the first place, and as I mentioned, many people, 80% of people who have gallstones generally are asymptomatic. It's not until there is kind of a flare-up, one would say, they then seek out treatment. But it is certainly advantageous to make sure that if you do know that you have a history of gallstones, that you're doing the right thing when it comes to the different lifestyle modifications that you may be taking right now. So I'm Amanda Williams, MD, MPH, and let's get right to it. Let's talk a little bit about cholethiasis. Not only is that an incredibly fun word to say, it is a very important thing for us to understand. We have recognized for many years that certain groups of people certainly have a higher risk of developing gallstones. Women certainly fall into that category, and oftentimes this is driven because of estrogen. So we see this even in women who are maybe on hormone replacement therapy, birth control pills. Certainly, we find that there is a greater likelihood for the development of gallstones. As we get older, the development of gallstones certainly becomes a risk factor. You usually don't see younger people with gallstones, but as we get older, this is certainly a risk factor. There is a genetic component to this because we do see a familial aspect where it can run in families. Now, there is something very important to be notated about this, and that is it technically the gene pathway, in which we can look at the different cholesterol pathways and the familial hypercholesterolemia, for example, but we also have to recognize that this could be coming down to lifestyle. And so oftentimes dietary issues that are passed on from generation to generation following that standard American diet certainly can play a role into this. So much more research needs to be done to really pinpoint that genetic component versus lifestyle risk modifications. So this is something certainly in the future that I will be, keeping an eye on as genomic medicine in general is starting to expand and get much more widely diverse when it comes to different disease states and looking for those underlying factors. Now, we know that those who are overweight or fall into the category of obesity certainly have that greater risk, especially women who are overweight or obese. So this is a classical sign when you look at someone who has gallstones. It's usually a woman over the age of maybe 40 years old, overweight, and this is a pattern that we quite often see in those who are impacted by gallstones. But what exactly is a gallstone? And, how do they develop in the first place? Well, we know that they're incredibly common. We know that so many people every single year have to seek out treatment and oftentimes surgical intervention, having the gallbladder actually removed because you get not only such significant inflammation, but there is severe damage that can occur. And if you end up with a gallstone that is blocking one of the ducts, then that also becomes incredibly problematic. So we can go into the anatomy of it. We can look at the biliary tract, which is made up of the gallbladder and the bile ducts. And this is what helps with digestion. We're looking at fat digestion because of that release of bile. But we know that those bile ducts include the hepatic duct, which hepatic, we think of liver. We have the common bile duct, we have the cystic duct, and the bile duct also carries waste as well as digestive juices from the liver and the pancreas into the small intestine. So you can see why if we have these stones that are developing, this can become incredibly problematic. Now, there are two different types of gallstones. There are cholesterol stones, and then there are pigment stones. The cholesterol stones, these are usually this yellow-green color, and this is what the majority of gallstones are made up of. Probably 75% or greater of gallstones are actually of that cholesterol variety. And then we have the pigmented stones. These are darker in their actual color, and they are actually made up of bilirubin. So I don't have to get too far into the details on that, but we really want to recognize that gallstones are basically these hard, pebble-like pieces of material that are made up of this component of cholesterol and bilirubin that form within the gallbladder. And then the gallstone itself can start to block the bile duct within the biliary tract. And this can cause severe sudden pain. And people generally will describe that in the upper right part of the abdomen. And the pain can be so significant that they actually call it like a gallbladder attack or biliary colic. So we know that this is a very problematic problem here in the United States because of our diet. And we know that the typical standard American diet or the Western diet is a precipitating factor that leads to this. We also recognize that the lack of dietary intake of key nutrients that can help to fend off the formation of gallstones certainly plays a role into this. So when we look at things like low vitamin C intake, low omega-3 intake, for example, we know that these are going to be reasons as to why someone can develop gallstones. So we have all these different factors that can line up. We can look at bad diet, we can look at being overweight, we can certainly look at the estrogen component that plays a role for women in particular for driving up that risk of developing gallstones. And if you've ever had a friend, family member, coworker, anyone who has ever had a gallbladder attack, they will tell you that that is by far some of the worst pain that they can ever experience. And this can last, for up to 24 hours. And this goes along with, you can get a fever because if there's an acute infection, because the more blockage we got, remember we have different waste that is supposed to be traversing through that area. And if we have a blockage within the biliary tract, that is going to be a real big problem. So many times people can get, nauseated, even, throwing up. So we have the vomit aspect to that. But also we can look at jaundice, because remember, if we have this bile that is building up and the liver is not able to function properly, then we can start to develop jaundice, which is the yellowing of the skin, or you can see it in the white of the eye. And this is also a key indication. Now, as far as treatments for traditional standard medicine, if it comes to the point where it's so severe where they have to actually just go in and remove the gallbladder, then that is, obviously the surgical option. But they have also looked at different medications that they will put people on, such as the cholesterol lowering medications, the statins, for example, looking at metformin. So trying to regulate that metabolic syndrome is oftentimes a avenue that doctors will go down. And they will usually try to give a little bit of guidance when it comes to trying to change up the diet, but they usually don't spend enough time on that. So this is why having a diet that's rich in fiber, hence following the Mediterranean diet where you're getting adequate exposure to fruits and vegetables and really healthy fats that actually protect from the formation of those gallstones in the first place. This is very, very important. We also recognize that if weight is an issue, if you're overweight or obese, that getting onto a regimen where exercise along with the proper dietary intake is certainly going to be critical. But then we get into the fun stuff. Then we get into the different nutrients. And I had mentioned earlier vitamin C and omega-3 fatty acids. Well, we know that vitamin C helps to lower oxidative stress. And we know that oxidative stress is a component or a contributing factor, one would say, of gallstones forming. So if we have low vitamin C intake, this can actually link to an increased cholesterol concentration within the bile itself. And so they have done different studies showing that regular vitamin C users, so people who supplement with vitamin C on a regular basis, were actually close to 70% less likely to have gallstones than those who did not supplement with vitamin C. So that in and of itself is really, really impressive. And we can go all the way back to 2009, and they published a study looking at vitamin C specifically and how this could protect against gallstones. This was an observational study, and this was published in the British Medical Journal of Gastroenterology. And they said in animal studies, they have been able to show the protective effect of vitamin C on the formation of gallstones, but they weren't exactly sure as to how this would translate into human studies. So this is why they did this particular study. And they had a cohort of over 2,000 people between the ages of 18 and 65. Now keep in mind, gallstones generally form in people 40 and older, but there's always those outliers. So this is a really good study because it's looking at people from the age of 18 upwards to 65. And in this, they did abdominal ultrasound. So they were, looking for that detection of the stones themselves. And the prevalence of people who had gallstones in this particular population that they tested, remember over 2,000 people, it was 8%. So these are, once again, asymptomatic people. They had no idea that they had gallstones, but after doing the ultrasound, they found that 8% of these people had gallstones. And then they were looking at their dietary intake of vitamin C. Now, interestingly enough, those people who took vitamin C did not fall into that category of people who had gallstones. So this is kind of what their conclusion was, that regular vitamin C supplementation, as well as, having an active lifestyle, so being physically active, and total cholesterol levels being within a normal range, led to a reduced prevalence of gallstone formation. So we see this type of a study and we recognize that there's many different aspects. It's not only the role that vitamin C is playing in terms of oxidative stress, we also know that it plays a role when it comes to bile acid formation itself. So I don't want to get too complex on this, but it's just worth noting that vitamin C certainly does play an integral role when it comes to the way that the body is managing not only the formation of bile, but the cholesterol transport in the body, as well as fending off oxidative stress. So hence, vitamin C. So if you know someone who has a history of gallstones, they should be probably taking vitamin C on a regular basis and making sure that they have foods that contain a good amount of vitamin C on a regular basis as part of their diet. Now, we can also look at omega-3 fatty acids. So whether we're looking at fish oil, krill oil, flaxseed, we know that omega-3s help to ease inflammation throughout the body. But how would that play a role when it comes to gallstone formation? And through clinical research studies, they've been able to show that supplementation with omega-3 fatty acids was actually shown to lower the risk of developing gallstones, partly to that decrease in inflammation, but also in terms of helping to support healthier weight. So once again, we can start to look at some of the clinical research on this. And we can go back to 2001, and in the Journal of Nutrition, they were looking at fish oil supplementation being beneficial in terms of gallstone formation in obese women. Now, what was really quite interesting is the study initially essentially was, would fish oil help these women with more productive weight loss? And in doing the study, they were like, wow, not only is it beneficial when it came to weight management, it was actually beneficial in the prevention of gallstone formation. And the researchers at the time, back in 2001, this is one of the areas that they kind of focused on. They said, okay, well, we know that the omega-3s certainly have been shown to reduce the risk of, coronary heart disease, but they were not exactly sure as that mechanism as to how it was working in terms of reducing gallstone formation. And it came down to, once again, the cholesterol transport in the body. And the women in this particular study, their main goal was to lose weight. And they did this double-blind placebo-controlled trial. And the women who were given the fish oil, in addition to the other components of this study, which was, diet, exercise, they found that the women who were given the fish oil not only had better weight loss, but they also found the prevention of cholesterol gallstone formation in these women. So there's so much to be said about just the basics in the human body when we think about omega-3 fatty acids, when we think about vitamin C, and we can even go beyond that and we can look at SAMe. And we know that SAMe is very important when we are looking at methylation in the body and the correlation of that with neurotransmitters, but also with cholesterol. And they have been able to show that one of the roles that SAMe plays is to help to improve bile flow in people who have different liver diseases, such as cirrhosis, for example. But they thought, well, if it's helping in those aspects, would it do anything when it comes to people who have gallstones? And sure enough, all the way back in 1990, and it was published in the journal called Drugs, they found a role for SAMe in the treatment of gallstones and showing the clinical efficacy of SAMe in the treatment of those who had gallstones. They looked at 4 different clinical trials, and this included women who were on hormone replacement. We're looking at that estrogen component. They were looking at people who fell into the category of metabolic syndrome. And what they found was that SAMe treatment actually decreased the incidence and the development of gallstones. And it's really quite interesting when you look at the biochemistry of this pathophysiology and you realize how SAMe is actually impacting certain metabolic pathways and detoxification pathways. So we know that when we think about methylation, that's key to detoxification. So there's so much information out there that we know so much more about now. And to a certain degree, it's really quite fascinating when you look at other research done with iron and realizing that even iron, those who have iron deficiencies are more prone to gallstone formation. So if you see someone who has low iron status, low ferritin levels, having iron supplementation as part of their daily routine oftentimes can help to offset that development of gallstones. Vitamin E, for example, antioxidant power of vitamin E to fend off the oxidative stress. We can look at things such as melatonin and milk thistle. These are all different nutrients that have been shown to be very targeted towards those different ways in which gallstones form. But we can also look at EGCG coming from green tea. Now, interestingly, this has been studied for probably the last couple of decades, and we know that green tea does so much. But looking at how EGCG, the epigallocatechin gallate, can actually reduce the susceptibility of gallstone formation, especially of that cholesterol variety, which we know that upwards of 80% of gallstones are of the cholesterol variety. And the study that they did was looking at the mechanism by how it was that the EGCG was actually working. And interestingly enough, it came down to inflammation. And it showed that EGCG could actually reduce the susceptibility of cholesterol gallstone formation through the regulation of inflammation. So it always goes back to that. It goes back to, bad diet. It goes to chronic inflammation. And there are so many things that we can be doing when it comes to targeting those who are more at risk for gallstone formation. And obviously, if someone has a history of developing gallstones, they at least have a little bit more information at this point in time now to know, what should I be doing? Should I be looking at my iron levels on a more regular basis? Am I taking enough vitamin C and vitamin E? Do I take omega-3 fatty acids every day? Should I maybe be sipping on green tea on a more frequent basis? There are so many things that we now know about gallstones and the way to manage them. That is why I specifically wanted to talk about that today. And that is all that I have for you today. Definitely go to our website, check out our EGCG formulations. We have our green tea HX, very good option. The green tea TX, the tincture would certainly be a good option. Vitamin C, fish oil, Sammy, you can check all of those out on our website. I want to thank you so much for tuning into the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.